The 11th of December. You're listening to today's Lynette Fay Show. Now, we've mentioned it already, 2 weeks to go. Most of us are thinking about our own Christmas with family, perhaps, what we're going to get from Santa, what we're going to eat or drink or watch. But then there are people who we are calling Christmas champions and community Christmas champions who go that wee bit further for their communities this time of year to make sure that as many as possible can have a safe and a happy Christmas. And in studio, we're going to talk to 3 women who are doing just that, and they're especially giving voice to women in their line of work as well. We have Lisa Morrison, Magz, Gibney and Siobhan, McCallin. You're all very welcome.
Thank you.
Great to see you all today. So you're here from New Script Mental Health, which won an Aisling Award a couple of weeks ago, known as the Belfast Oscars. But for anyone who hasn't heard of New Script Health, what are you? Who are you? What are you setting out to achieve, Lisa?
So thanks so much for having us on, Lynette. It's lovely to be here. We are part of Participation and Practice of Rights, PPR, and this was founded in 2004 with Ines McCormick. So this has been going for a good while. There's a strong foundation, and there's housing and asylum seeker, kind economy. So there's different parts, and we're part of the mental health campaign. And what happened during COVID is there was that time just to sit back and reflect on what had been happening in the campaign, which had been trying to fix things that were broken in the system. And we started to think about, and these 2 fabulous women are going to talk to you more about the rest of the Story of Writing program. But we started to think we need to reimagine a new script, a better way, a better approach to mental health, a more community, grassroots. We have this thing of you give voice to people. We don't give voice to people. People have their voice. They have their inherent worth, their strengths, their skills. It's about the conditions we find ourselves in which allow us to be heard or not. So the new script has 3 parts to it, but it's about a new way of thinking about mental health. We know from the research, we know from the World Health Organization that social determinants, poverty, you think about the cost of living crisis, violence against women and girls, housing. These are issues that are causal factors, and then we end up in a system that medicalizes and individualizes that distress. And what we're calling for in a new script is to say we need different approaches, more creative approaches, more connected, compassionate, human approaches. And we're not addressing with mental health very often chemical imbalances. That myth has been debunked. These are about power imbalances. So it's difficult because we don't have a definite answer. We're finding a way together as a social movement. One of the strands is to hold government to account. For example, the RQA haven't been inspecting mental health services for the last 14 years, community mental health services. How is that acceptable when we're trying to have parity between, mental health and physical health? That's just one example. So we try to bring to light these things, data as well. In 2023, the statistics was saying, look, the data is so poor here that we actually can't say how effective mental health services are. That's problematic when we're putting money into things that we don't know. So that's one strand. Then Magz and Siobhan are going to talk to you about alternative approaches. Mm-hmm. And this is all researched and evidenced as well, about addressing trauma, about addressing housing issues and all of that we need those more creative. We need to connect with each other. 5 Steps talks about self-care, the 5 steps of well-being. And that's really important. We're not saying that it's not, but it's very individualized. So if you're really struggling, if you're suffering from some kind of violence, if you can't put food on the table for your kids and you're being told to go out and take a walk, or you've been over-medicated, which is another issue, very difficult to do those things. So we're talking about collective, and people on the ground need their voices heard. And then the third part of the campaign is called collective care, because what we believe, we're all people who have experienced trauma, difficulty. We're coming together to say we want a new way, we want a better way. Everybody is included. And collective care is about if we don't look after each other and ourselves first, we've got to live the values that we profess.
And Siobhan, that idea that Lisa's talking about addressing trauma, and the question, something very simple that you flip on your website, is the question of what's wrong with you? that's changed to what happened to you.
Yeah.
So you're immediately addressing trauma by just changing something as simple as that question.
100%. And for me, I feel really lucky to be involved in the campaign. I had to medically retire at the age of 36 from primary school teacher. I had sepsis. It was a life-threatening ordeal, and I was subsequently diagnosed with ME. So I was very lonely and isolated, and I knew what happened to me, and I knew why I was feeling this way. Antidepressants were making me feel worse. During the lockdown, I had the opportunity to meet with Sarah, and we got involved in the rest of the story with Boston-based author Michael Patrick MacDonald, and it's looking at trauma from a different angle and giving people the opportunity through prompts to tell your story of why am I here, why have I arrived at this destination. And what Lisa was saying there about, you know, going from being on a teacher's salary, when you think you're on your way to become a vice principal or a principal, and all of a sudden the rug's pulled from beneath you and you're on benefits or dealing with medical pension, it's a really scary place to be, especially if you still have a young family. I have 4 children. What the rest of the story did was it brought people together from across the north, but also a transatlantic alliance with Michael Patrick. So at the launch last year on the 1st of February, we had Louise Kennedy, whose book you may well know has went bestseller throughout countries all over the world. We have had the opportunity to have Louise on. She comes on Zooms with us every now and again, and you know, it's a bit of crack and banter, but she's another person who's went through a health battle and understands trauma, and it's just making us feel that we have the ability to put our stories down, but equally our stories should be heard, and helping each other. That connection and solidarity can really lift you, especially when you have been down for a while.
And Magz, it's like what Lisa was saying about empowerment and finding the power in your story and owning it. So,
100%.
you know, how do you translate that though to somebody who does find themselves in a really bad, scary place at the minute? How can you convince them that is possible?
I think, you know, when I first came to the campaign, I came and I was a professional working in, you know, I was doing my master's in counselling and psychotherapy. We were laughing before we came in. You know, I went to train and I was like, this is what my granny taught me growing up, drinking cups of tea on the Shankill Road. Do you know what I mean? It was like, it's, and I think a big part of the campaign is about humanising things again. Do you know, it's that, and part of it for me is about seeing ourselves as human beings. You know, when professionals are trained in mental health, or we're training or whatever, you're taught to disconnect your personal and keep the professional separate. But actually a big thing that we are doing is we bring our whole selves. I'm there as a counsellor and somebody who works with women who do find themselves very much on the, you know, living on the poverty line, women who face massive discrimination within the mental health system, women who have experienced multiple complex traumas. But I'm also in the campaign as a survivor of sexual abuse, as a survivor of domestic violence, and as a carer for parents who have suffered because of the trauma here in Northern Ireland. So for me, it's very much about finding our voices as human beings and sharing stories. You know, we've done it across the world for centuries. We have women involved in the project who have gone through horrendous experiences in terms of violence and war in other countries and come seeking asylum here. And there is this sense of, at the minute, you know, there's a lot of adversity, a lot of change. You know, people are, you know, I was out with a woman last week who was literally going, I literally can't go on. I have nothing in terms of supporting my kids and my family here at this time of year. But actually, what we are doing is we're bringing people together in a creative way, you know, to kind of come together to share stories.
So what happens when you do bring them together? You know, say that woman you've just mentioned there. I suppose there'll be people listening to this thinking, right, okay, so you're finding your voices. There's a lot of empowerment here, but how does it practically work? You know, do people find you? How do they find you if they need your help, or do you find them?
So we have our campaign's called The Rest of the Story, and you can go on PPR. That's Practice and Participation of Rights website, and under the mental health campaign, what we've been doing the last year is asking people to write their own script. You know, what would you like to see on your script in terms of mental health? And people have been sending us in different bits of information with people who are, people who have been part of the mental health system, people who work in it, people who are carers, family members, anyone who has an interest in wanting to kind of change things for the better in terms of mental health here, come and get involved. You know, we're trying to do things a bit differently. Instead of trying to change the system, we are still doing that, but we're trying to create a different way of doing things. So we are running programmes, you know, like we designed a thing called the Travelling Apothecary. So we've been going out and doing workshops in different community groups around Northern Ireland, and we're bringing, we designed this apothecary, and people can choose an emotion. So it's trying to normalise human emotions as well.
I think to say that we're not a service. Okay, we're building a social movement. Yeah. So we're not a service. So like the rest of the story, the travelling apothecary, we have these alternatives that we offer, and we're trying to promote as well and bring to light what's happening in the communities. We partner with Glorna Mona. We're running some education workshops, bringing in critical voices around having new conversations. Mm-hmm. But we're building a social movement, so it's not an individual service, but it is calling for people to come together. We've got professionals working in the service. We've got these things. We go out to youth groups, to support workers, to actually encourage us to think about a different way of thinking about mental health. We're so stuck on it being a problem located in with you, what's wrong with you. And we're trying to say we need to challenge this. And in challenging this, in having the conversations where everybody's voice matters.
And it's an interesting, because what I'm getting out of everything that all three of you have been saying since you came into the studio today is that you're challenging mental health by talking to people and getting them to talk. So it's one of the most simple things that we can do. We're all good talkers. But that's what we do best in this part of the world.
We're about to do, we're working with Damien Gorman, the renowned poet and playwright. He's just fabulous, and we're doing a thing called Desperate Monologues. It's going to happen on the 1st of February to coincide with the launch that took place last year. And like even the title Desperate Monologues, what is desperation? What is despair? What are the factors that get you to that stage? And more importantly, how do you get out of that? And you know what the girls are saying about there not being a service, but we can signpost people to where they need to go if they do need help at times, you know, because we might not have the answers, but we know where to send them to get that help. But for us, the creative side, you know, like the travelling apothecary that Magz spoke about, it's like an old-fashioned medicine cabinet, and you go and select a poem on the emotion that you're based upon. There was a woman one day, she came along and she just said, I just needed that today. I don't know why, but that just spoke to me. So it's
and there you go. That was your medicine. That's what you needed.
It's your medicine, And connection is so important. That's one of the main things that I get out of the group personally. You know, we've been in City Hall with Tina Black when she was Lord Mayor. We've been up to Stormont, and all parties, every single party turned up that day because we were worried that they might not, with Stormont being down. But every single one of them did. They all spoke. They were blown away because we do have data and research. There's academics involved. Phil Scratton, who's headed up the Justice for the 96 campaign, is a massive help and assistance to us. And you know, when Phil's around, you can't help but feel better about yourself. He just lifts you up. So there's been a lot of good.
There's a lot of good and obviously a lot of passion towards it as well, because each one of you have spoken really passionately about this movement and what you want to achieve from it. And you mentioned, Siobhan, that your launch was in February. So that's only, 10, 11 months ago?
Yeah.
So Lisa, from that launch, what has happened in those 10 months? What difference have you seen that
we have
new script has made?
Away by the people who have come along, who have said, we want to get behind this. I think things are so difficult at the moment, and what we're trying to do is say we need to bring joy, creativity, connection back into what we are doing to challenge things. And I think we get a laugh, and choice, connection, compassion and community are our values. And we've been blown away by people from every walk of life saying, we want a new way. We want better for people. We want better for ourselves. We don't want other people to suffer like we have. There's a new all-party group in England just formed with Lord Crisp, Nigel Crisp, all-party group asking for beyond pills, because overprescribing here in the most deprived areas is crazy.
And also women.
Women. We end up in the mental health system medicalised, pathologized, and we want no more shame, no more blame. We want to start, creating conditions. So just the support we've had, we don't get funding. If you want to fund, please do go onto the website, Mental Health Campaign. You can sign up to our email, come along to our education classes.
That you've got
all the information.
We've got the message, Lisa, and the passion is there to the very end.
And a big shout out to the Aisling Awards, because that was a massive celebration for us as a group. We really felt seen and heard, and it was just a wonderful occasion to get dressed up and come along and just have a brilliant night. So massive gratitude for that.
Lovely to talk to all three of you, Lisa Morrison and Magz Gibney and Siobhan McCallin. Thanks for coming in to the show this afternoon. And if you've been affected by anything you've heard in that chat today, you can get help on our action line at bbc.co.uk/action line, and you can go to nlb.ie for more information on the new script for mental health as well.